Thanks for joining us today. Welcome to the Center for State's video series on implementation planning and capacity building. This series is produced by the Capacity Building Center for States and funded by the Children's Bureau. The Implementation Planning and Capacity Building Brief is intended to help child welfare agency leaders, managers, and stakeholders take a structured approach to planning the implementation of an activity, program, or intervention to address a problem or need, and consider strategies for building agency capacity to implement it. It does this by providing step-by-step guidance to prepare for implementation, make a plan for addressing any gaps in capacity or capitalizing on strengths, and then develop a plan for implementation that includes the actions needed to get ready, actions needed to implement, and actions to measure implementation progress. Implementation planning and capacity building is broken down into 3 parts and 8 essential functions, or steps, that may be presented linearly, but they often overlap and teams will loop back and forth between them. At this point, teams should have outlined the elements to include in their plan, identified the sources to pull the information from, and considered the context and how it may impact implementation. Then revisited their teaming and leadership structure and reviewed readiness assessment findings. In this module, we will look specifically at developing strategies to build capacity. Developing strategies to strengthen motivation will be addressed in the next module in this series. And then part 3 is development of the implementation plan, which includes building the work plan activities to prepare, roll out and measure the intervention, communicate and engage stakeholders, and then consolidating and reviewing the plan as needed. Let's get started. Why do teams develop strategies to build capacity? To create favorable conditions for implementation within the agency that will support implementation efforts. For example, strategies to develop resources and infrastructure, build knowledge and skills of staff, encouraging the culture and climate that supports change, and the engagement and partnerships that improve results. Without sufficient capacity, the intervention may fail to achieve the desired outcomes and result in wasted resources and lost opportunity. Although it should not be considered a replacement for ongoing readiness assessments, strategic capacity building efforts can ultimately lead to more long-term improvements in readiness for this and future change efforts. After teams review their readiness findings, they move on to developing strategies for building capacity. These strategies should support effective implementation of the selected intervention, and teams will integrate them into their work plans, which will be described in greater detail in later modules in this series. Teams may identify strategies through a variety of additional sources, including team members and other stakeholders, peers who have addressed similar issues, or intervention developers who may have experience with different settings, and the literature on capacity building and implementation. Decisions and plans for building capacity will be influenced by existing capacity, as well as external factors, for example, the available timeframes, and where and how teams plan to introduce the intervention, maybe through pilot testing. The Capacity Building Collaborative has organized different aspects of organizational capacity or competency into 5 broad categories that can be used as a framework for considering needs and identifying strategies that meet those needs. Resources are the concrete materials and assets. Examples include staff, facilities, and training curricula. Infrastructure are the organizational structures, protocols, and processes. Examples are structures for hiring and training staff, information systems, and policies that guide intended behaviors. Knowledge and skills is staff expertise and competency. Examples include leadership skills, change management expertise, and knowledge of intervention-specific practices. Culture and climate are the shared beliefs, values, and attitudes that influence behavior. Examples include the leadership vision and a shared commitment to initiatives. And then engagement and partnership. This is the intra-organizational and inter-organizational relationships and connections. Examples include family involvement, collaboration with court partners, as well as service delivery partners. It's important to note that not every team will need strategies in every area. Not all strategies are appropriate for all circumstances, and selected strategies should be tailored to an agency's specific context and needs. Let's spend a few minutes looking at some examples of strategies in each of these. Organizational resources are the concrete materials and tangible things that support programs, practice improvements, and service delivery. Strategies in this area may address, for example, stable leadership, like building leadership strength among middle managers and cultivating ongoing leadership support. Sufficient and appropriate staff to manage and deliver intervention services, like developing recruitment strategies or reassigning existing staff. Appropriate facilities and materials, like making changes to physical workspace or working with program developers to access and adapt materials. Adequate funding, like identifying opportunities to braid or blend available funding streams through partnerships or developing a funding strategy. And program champions, like identifying strong advocates for the intervention and formalizing roles to empower them to lead efforts to move the intervention forward. It is important to recognize that these examples may not be appropriate for all agencies and that teams will need to consider strategies that are appropriate to their agency context, levels of readiness, and capacity. Organizational infrastructure are the systems, structures, policies, protocols, and processes that help the agency function. This includes systems that the agency would use daily in their regular operations, such as a data and information system, and things that might be specific to the intervention. For example, targeted program evaluation. Teams may develop or refine agency infrastructure and systems, and they should pay close attention to agency needs for implementation supports or drivers that support effective and sustainable implementation of intervention programs or practices. These may include staff recruitment and selection, like developing job descriptions and interview tools that reflect needed competencies for the new intervention. Training, coaching, and supervision, like designing comprehensive training and coaching plans and the materials to build needed knowledge and skills at all levels. Performance assessments, like identifying performance indicators and measurement tools aligned with intervention practice profiles. Data systems, like partnering with data experts to structure data systems that collect and report on data related to the intervention. Policies and procedures, like making procedural changes to address potential implementation barriers. And communication systems, like identifying communication channels for informing internal staff and external partners about intervention progress and achievements. Organizational knowledge and skills reflect the expertise and competencies needed to do the work of the intervention. For managers and administrators, this includes knowledge and skills related to adaptive leadership, change management, program planning and delivery, evaluation, and CQI. For frontline workers, this includes understanding and using the new interventions practices. Often strategies to strengthen knowledge, skills, and abilities for implementation of a specific intervention can use existing training and coaching structures. These may include, for example, knowledge, skills, and abilities specific to the intervention, like adopting a train-the-trainer model that brings intervention purveyors to train managers, who then train frontline staff. Expertise to collect and analyze data, like arranging coaching partnerships between data leads and program staff to support quality data collection processes. And intervention monitoring and evaluation, like forming partnerships with a local university for external evaluation support. Organizational culture and climate are the shared values, norms, attitudes, and perceptions that influence how people in an organization behave, and potentially how people accept and support change. An agency's culture and climate will reflect factors at various levels of the organization that impact readiness for implementation. Acceptance of a new intervention is often set at the top of the organization, but frontline workers are often critical change agents through the use of new procedures and practices. Also key to establishing widespread buy-in is engagement of diverse stakeholders in implementation planning, including youth and families in the target population. To strengthen readiness for implementation, teams may consider strategies that address the following aspects of culture and climate. Leadership buy-in and support. For example, ensuring that leadership is knowledgeable about the intervention's benefits and timelines. Shared vision, like encouraging ongoing communication to explain and reinforce how the intervention supports the organization's vision, values, and goals. Receptivity to change, like encouraging and rewarding staff for innovating and trying new ways to solve problems. Meaningful work, for example, sharing stories and firsthand accounts from caseworkers, family members, and community members about experiences related to the new intervention. And manageable stress, like clearly communicating about upcoming changes and monitoring workloads of staff responsible for the intervention's service delivery. Organizational engagement and partnership is the relationships within the agency, for example, across program areas, and with families, youth, resource parents, community, and cultural groups, as well as partner agencies. Engagement and partnership needs will vary with the intervention, as some may require close coordination with courts or tribes, while others might need strong collaboration with community service providers. Teams may look at strategies that address these aspects of engagement and partnership as they prepare for implementation. Structures to support partnership include building networks that facilitate information across systems, with common objectives and creating interagency implementation teams. Engagement in planning and service delivery, for example, inviting diverse stakeholders to participate in implementation team work groups in meaningful ways. And buy-in and support, like communicating how the intervention's expected outcomes support the particular goals of external stakeholder groups. What helps teams to develop strategies that will build capacity? Teams should consider using the broad dimensions of capacity as a frame for considering organizational capacity, and using the subdimensions under each of the 5 broad areas for capacity building. Teams should also think about how they can tailor strategies to agency-specific needs and context. For example, organizational engagement and partnerships may include engaging court personnel in a meaningful way, or for meaningful work might include incorporating intervention stories into the agency newsletters. Let's take a moment to check in on what you've learned about developing strategies to build capacity. Why do teams develop strategies to build capacity? To build the conditions needed for implementation, to reduce the risk of wasted resources and lost opportunity, and improve future readiness. How do teams develop strategies to build capacity? Using readiness assessment findings, stakeholder feedback, and peers or developers to help think through the intervention needs and prioritizing what needs or gaps are critical to the implementation effort. What can help teams develop strategies to build capacity? Using the 5 areas of capacity and sub-areas to identify and prioritize strategies for building capacity before and during implementation, and tailoring the strategies to specific agency context. Now take this a step further by reviewing the reflection questions for develop strategies to build capacity in your implementation planning and capacity building workbook to connect what you've learned to your own experience. Up next is develop strategies to strengthen motivation, the 6th module in this series and the second part of this function in implementation planning and capacity building.
This video was created by the Capacity Building Center for States, funded by the U.S. Department of Health and Human Services, Administration for Children and Families, Children's Bureau, under contract HHS P23320140033C. The content of this video does not necessarily reflect the official views of the Children's Bureau.